So what exercises are safe to be doing during your pregnancy? First of all, I want to be clear that there actually is no list of quote unquote safe exercises to do during your pregnancy. Now, if you're about to click away because you're mad that there's not an exhaustive list, please stay for just a hot second, because that's actually a good thing. We want to be able to have a framework to be able to better determine, is something supportive, which is actually the word I prefer to use with my patients instead of safe. What is supportive for your body, for your baby, and your pelvic floor while you're moving? If you have been told by your birthing provider that you have a specific medical reason why you can't be doing a particular exercise, then you need to follow that recommendation. But I still encourage you all to ask more specifically the why behind that recommendation, because I can't tell you how many times I've had my own patients be told, don't do something at a particular week in their pregnancy, only to have them follow up and the provider tell them, well, because you're pregnant, you should take it easy. If you have a non-complicated case and no restrictions in terms of what you should be doing for your exercise other than you are pregnant, we want to be helping you to stay active through your pregnancy, because exercise, a combination of cardio and strength training, is essential for supporting your health, the health of your baby, and the health of your pelvic floor. In this video, I'm going to provide a framework for you to be able to know how to listen to your body, i.e. knowing what symptoms to look out for that indicate a change needs to be made for your movement. And then if a change does need to be made, what things you can change in order to improve that movement for your body. So first, let's go over the common symptoms that I want you to look out and listen for in your body so that you know if a change needs to be made. So first, I'm going to go over pelvic floor symptoms, and then I'm going to go over full body symptoms. So in terms of the pelvic floor, we want to be looking out for any specific pain in and around the perineum and pelvic floor muscles specifically. And this also includes any pelvic floor heaviness, as well as any leaking that may occur during your workouts or within 24 hours after your workout. So if you have any of these symptoms, we don't need to immediately shut everything down, but it's an important point to note that there's feedback that the body is saying a change needs to be made. And we're going to go over how do I determine what those changes are in the next section. Now, in terms of your overall body, here are the things that I want you to look out for. So once again, if we have pain that is occurring anywhere in the body, we want to get curious about that. We don't need to shut everything down once again, but we want to pay attention. The body is trying to give us information that something needs to move differently. Now, when you're doing your workouts, it is normal to feel a certain amount of fatigue based on the amount of effort that you're putting into your workout session. But if you're noticing an extreme amount of exhaustion in between sets that doesn't match the intensity of your workout, or within 24 hours after your session, you're noticing that it's really difficult for you to have an appropriate level of energy to do your day-to-day activities, that is a really big indication that we went too hard in our workouts and really need to be thoughtful about scaling back the intensity and having more recovery days in between. And then finally, we want to be thoughtful of an excessive amount of shortness of breath, dizziness, and headaches. These are all really big red flags that we want to be thoughtful of, that again, our cardiovascular system is being challenged beyond a helpful level and that we need to scale things back. So how do you actually scale back? Meaning, what modifications can you actually make? So while you're doing your movements, if you start to experience any of the symptoms that I mentioned earlier, I want you to look at that as helpful feedback and information to make a pause and then ask yourself and explore these following things. So first, I often recommend that my patients start to pay attention to their breath and making sure that they are breathing well and continuously throughout their exercises. I know this seems like a no-duh kind of thing, but I can't tell you how many times my patients will catch themselves holding their breath while they're going through a particular movement. So check in, are we breathing? Another point is noticing the speed at which you are moving. If you reduce the speed, does that help to reduce your symptoms or to fully mitigate them altogether? So adjusting the pace that you're moving at can be another helpful way to make a change. Additionally, can you change the amount of weight that you're lifting? So during your strength training sessions, and I encourage you to be doing strength training during your pregnancy, if a particular weight is creating any of those symptoms in your body, can we slightly reduce that weight and continue to be able to move through the exercise? Also, if we're doing any higher impact exercises, and maybe that's bringing on symptoms, can we reduce the impact and make it a lower impact type of movement? And if you're experiencing any pain as you're moving through a particular exercise, I want you to check in and say, hey, is there a particular depth of the range? Can I move through a shorter range where I don't have pain versus going through the entire range? An example might be going through an entire full depth of a squat. Maybe at the full bottom depth, you feel some symptoms, but only going through 75% of the depth of the squat, you feel great. stay within that 75% and build strength in that range rather than going into a deeper range where you feel uncomfortable. We want to check in and say, hey, maybe we need a little bit more recovery between our sets and reps if we're noticing that we're a little bit more fatigued than feels appropriate. So giving yourself either less reps in your set and or giving yourself a longer recovery between sets to be able to help support you in that way. Because remember, you are moving for 2 and you are breathing for 2 right now. And then finally, also noting that if you are having a lot more of that extreme kind of fatigue and difficulty recovering between your sessions, make sure to check in and say, hey, do I maybe want to reduce my overall minutes in my workout to be able to continue to move more frequently throughout the week? Or do I need to have more space in between my longer workout sessions if that's how you prefer to move for your body? So again, none of these are hard and fast rules, but recommendations to be able to check in, notice what sort of the feedback that your body is giving you, and to be able to then make changes to continue to support your continued movement rather than all of a sudden just shutting things down without getting curious about what your body is trying to tell you. As you are going through and exploring these different changes in your movement routine and discovering that you would like more individualized support or saying, hey, this actually feels kind of overwhelming, I would like a movement professional to be able to guide me more specifically, then I strongly recommend connecting with a pelvic floor physical therapist like myself. We go through extensive graduate level training to be able to know how to guide people through exercise and through their specific chapters of life. And someone like myself, being a pelvic floor physical therapist, has specialty training to support someone during their pregnancy and postpartum periods. So you do not have to figure this out on your own, and I strongly encourage those individuals who want this kind of support to reach out to a pelvic floor PT so that we can guide you through your pregnancy and postpartum, and so that we can help you to figure out how to support your body best and keep moving well and often. Not just for your pregnancy, but also because motherhood is an athletic event every single day, and we want you to feel strong and confident for all of those seasons of life that you're heading into. So I hope the information shared in this video helps you feel empowered to keep moving well and often throughout your pregnancy. And if you have any further questions about exercise during pregnancy, feel free to drop them in the comments below so I can help answer them for you. And if you haven't already, please like and subscribe so that you can stay in touch for future videos coming your way.